guarantee. Nailed it. Then at the end of the month, a Local 3 viewer will win the jackpot. To enter, go to local3news.com.
Win money for yourself and a matching donation for your favorite charity. 3-degree guarantee.
If you have felt like this season has been one of the worst pollen seasons you've experienced in a long time, Dr. Marc Cromie says, ding ding, you win the prize because it's been one of the worst ones you've seen too in a while.
It is. It's been terrible, Julie. We've seen patients that are just miserable. Their eyes are swelling, they're sneezing, they're congested, they're having all kinds of issues with significant sinus disease, asthma exacerbations. But like we talked about in Atlanta, it's the highest pollen count they've ever seen. We're the same way here. It's been terrible.
So I know you have a very busy roster. In fact, when you leave here with us, you said you've got people coming in all day long. And those seasonal allergies are a problem for sure. But there's been some talk a lot lately in the news about our foods, and then food allergies come into conversation in that. You wanted to talk today a little bit about EpiPens.
That's right.
Specific with these food allergies.
So coming up in May is Food Allergy Awareness Month, and so we're going to be talking about a lot about it. And there's several things that are available now for food allergies that are different. We have an injection now called Xolair, which is treatment that's approved from 1 year and above. So even in these young kids with severe allergies, and it reduces the threshold of anaphylaxis. So if you are anaphylactic to peanut, one peanut can set you off into a severe allergic reaction. So this increases the threshold to 5 or 6 peanuts. So you're not going to go out and eat Snickers, but if you got accidentally exposed, you shouldn't have anaphylaxis. So that's a huge change. But the other thing that's cool is that we now have a nasal spray of epinephrine. So people that are tired of the traditional EpiPens, where they're scared to stab themselves, or they stab themselves in the thumb, or they just don't give it. The majority of people that have anaphylactic reactions don't get epinephrine like they should. They either delay in getting the injections, or they misfire. So this is a thing called the Neffy, and it is a new nasal epinephrine spray. So you just squirt it in your nose like you would Flonase or any saline spray, and this is the equivalent to an EpiPen.
So you said that lasts for 2 years. So does that mean once you purchase it, you can use it anytime in the course of 2 years?
Oh yeah, it'll have a 2-year expiration date, where the EpiPen is typically about a year.
Okay.
It's also heat stable, so you can keep it in your gym bag. So for all those kids that are playing sports in the summer, lacrosse or football or baseball, whatever, and they have to have it with them, this is ideal, so it won't go bad.
Well, let's talk about those kids, because adults with allergies are frightening too, food allergies, but at least you can understand it and regulate it. If you've got a 5-year-old with a food allergy, they have to grow up really fast, and they have to learn how to advocate for themselves. And then you've got to be so careful with their teachers.
Oh, it's a huge issue, and we're seeing it not only in daycares and churches, but in the schools. The cafeteria workers now are all, figuring this out.
Yeah.
It's a big deal. Not only safety, but even liability issues are involved.
So when I think of food allergy, I mean, I go back to peanut. That's what I think of. And yet, let's kind of just begin to name off food allergies that people can have. Eggs are fairly common?
Yep. So the most common ones are going to be milk, soy, egg, wheat, and peanut, okay?
In that order?
Yeah, and then tree nuts and shellfish are more likely to develop as you become an adult.
You've been doing this a long time. Has this always been the case for you, or has this been increasing over the years?
Well, definitely there's been a higher incidence of, I think, awareness. I do think that there's been an increase in food allergies over the last 50 years for sure. And a lot of it has to do with the way that the American Academy of Pediatrics and Allergies have been informing parents to avoid peanut early in life. It used to be that they recommended no peanut till 2 years of age. Well, now we know that that delay is what has caused the increase in peanut allergy.
Really?
Yes. So early introduction is the key. When you go to other countries in Europe, their first foods are often peanut butter bombas, which are like a Cheeto made of peanuts. Instead of us where we have Cheerios.
Yeah.
So instead of being exposed to wheat, they're being exposed to peanut. They have very little peanut allergy.
What about when you're expecting a baby? Is it a good idea as an expectant mother to eat peanut butter if you yourself are okay with it?
Sure. Matter of fact, if you have a child that has food allergies and you have a newborn that comes, you want to make sure that they're tested by a board certified allergist early, because if you find out that they're not allergic to peanut, you want to start giving them peanut at about 6 months of age instead of waiting until 2.
Really? Now, okay, that's the peanut side of it, but then you begin listing the soy and the egg and the dairy. That's a whole different issue.
Yeah, well, we don't need to lay those anymore like we thought.
Okay.
And the majority of those, 90% of kids that are allergic to milk and egg and soy will grow out of them. Where only 20% will grow out of peanuts. So we want to do what we can to prevent peanut allergy. The other foods that do occur, those typically kids will grow out of those as they get older.
Not to bring up a negative, but wasn't the EpiPen at the center of attention a few years back when insurance did some things and it got super expensive?
It was like $500-600. It was crazy.
That's gone though.
That is gone.
Okay.
There's generics that are available now, and also the new nose sprays. The company has put out coupons that makes it very affordable if you have regular commercial insurance.
Okay, if you suspect that a child might have a food allergy, or that because you can develop a food allergy as you get older too, what are some things to watch for?
So the classic symptoms are going to be itching of the throat, hives. 80 to 90% of people who have a food allergy will have a cutaneous or a skin involvement first, okay? But then the dangerous part is when they start having respiratory issues, like their throat starts to swell up. You can also have vomiting, you can have diarrhea. My son, when my wife and I were dating, her son was in my office and ate a cookie that had nuts in it. Never knew that he was allergic to foods. And then he started throwing up and had hives, and I had to give him epinephrine in the office.
You're kidding.
I saved his life, so she married me. It all worked out well.
And he was how old at the time?
He was like 6.
So see, it can develop just like that.
Yeah.
And also I think I know that whatever your reaction looks like today, the next one could be worse. There's no way to predict it.
There's no way to predict it. Now what we do have is we have new blood testing that we do that gives us a value of 0 to 100, and some of these foods have components. So we can break down the components of peanut, egg, and milk to determine whether you can have baked goods that might have eggs in them. Like maybe your 1-year-old can now have a birthday cake. We can do a blood test to tell you exactly whether that egg is heat labile or stable. So we can allow you to figure out what to give your kid. So see a board certified allergist, get allergy tested, and then we can give you so much more information. There's no reason to be in the dark.
And here's where you'll find them. It's the Chattanooga Allergy Clinic. They are all over the area. Just go to ChattanoogaAllergyClinic.com to find their office closest to you, or call them 899-0431. Thank you.
From the womb to the tomb,
Baby.
Oh,
What's going on?
now my car needs new struts and I can't afford it.
Well, have you called Budget Breaks? How?
Visit budgetbreaks.com for locations, coupons, and special bonus offers. Budget Breaks.
Want a flatter, tighter tummy? Then check out new Ab EX from